Recording in progress.
Hi everyone, my name is Agata Muszynska and I am based in Warsaw, Poland. And I'm psychologist, advanced level schema therapist, supervisor and trainer in individual and couples schema therapy. It's really my honor and my pleasure to be the part of World Schema Therapy Day today and to be here with you. And thank you very much, Eckhart, that you invited me to be the part of the group that presents on couples schema therapy. I hope might somehow and inspire you if you watch it, and I really would love if you enjoyed it. I decided that maybe it's worth talking a little bit about combining individual and conjoint work. So about the situation when we include a partner in the individual therapy, I do it quite a lot. So I decided that I would like to share. I will give the basic overview of Eckhart's model of modules in couples schema therapy, just to give us the context of what I'm talking about today. And then I will jump into talking about including the partner into the individual therapy and changing the individual therapy to couples therapy. And what I do, I offer usually a continuation of the individual therapy on the side, which might be uh, you know, a thing worth sharing. And I will present you my couple. The partner, when I included the partner of my patient to the therapy, we did couples therapy and the individual work of my previous patient on the side, but also something happened during the therapy to the partner that joined. And I did, on the other hand, the individual work in the presence of the partner, which might be also worth mentioning and sharing. Just to give an overview and the context of what we are talking about, Eckhart Roediger's model of couple schema therapy simplifies stuff that we are using in therapy, individual schema therapy. We basically talk about two needs in couples schema therapy about assertiveness and connection. And the person to be healthy needs to be and assertive and in connection with other people. So balance between those two. But also when I'm in the couple, I need to be quite often assertive to the other person, but also I tend to want to connect with the other person. We talk about two groups of emotions, annoyance and anger on one side. On the other side, it's more sadness and anxiety. And we basically talk about three coping strategies. So, very dominant, self centered, top dog behavior. We talk about very subjugated behavior, which is underdog. And we talk also about something like checking out with which might be a little bit more with the anger underneath, and checking out which might be a little bit more with anxiety and sadness underneath. We talk in the model about red and blue leg, which is connected with red is connected with assertiveness, anger, and more dominant, angry, self-centered behavior, or checking out red, right? And we talk about the blue leg, which is more connected with willing to connect with the other person. Blue leg is connected more with sadness and anxiety, and more with subjugation strategy or checking out, but more with the sadness and anxiety underneath. And the couples, they usually come when they are in the strategies of coping, when they are rigid. If they were flexible, they wouldn't come. But if they are stuck somehow in their rigid behavior, they tend to clash with each other, and then they just come to the therapy. And Roediger's model proposes modules that we can use to work with the couple. Basically, we do education with the couple, what's happening between them. We explain the clashes. We do clash card. We try to stop the clashes with them. We try to rebalance them. And if everything goes smoothly, we do conjoint work and we train healthy adult. We train them train them how to talk with each other, which is a connection dialogue. We give homework assignments. And this is basically our simple work. If something is going not so smoothly, we have like extensions, which are exercises and modules for externalizers. So for people who are more angry and more on the red leg and rigid in the more dominant self-centered behavior, or we have this extension for those who are more sad and anxious, and they are more tend to be more subjugated and less assertive, which is 7 and 8 module for internalizers. And if the couple is somehow not going so smoothly in the therapy, we can use the 5, 6, and 7, 8 modules to somehow work with partner that is more red and angry, or the partner that is less assertive and should set more limits. And then we use the 7, 8 module just to pop up a little bit the assertive side of the partner. If something goes wrong here, and if something doesn't work, we have also another possibility, which is individual sessions. On demand, the therapist can ask for the individual session or sessions, and also each of the partner can ask about the individual session if they want to share something that might be not for at the first glance for the other partner. So we have this opportunity of individual sessions on both sides during providing this therapy in this model. And these modules work very well when two people come together. But we often, this is not very rare, that we include the partner of our patient, and this is my case actually, and I do it quite a lot. When my patients, usually women, they want to come, they just realize that I already do the couples therapy, and then they want to come with the partner. And when we include the partner, then we have this, question mark inside us, what to do with the individual therapy that we used to provide. So I started to offer a continuation, not to everybody, because this needs some conditions, not very violent couple, not very rigid couple, but regular couple. It's worth trying out with them this kind of work. So I started to offer a continuation of the therapy, individual therapy, to my patient, the former patient, I mean the primary one. And then if you do it, you have this question in yourself, what to tell the patient, what to tell the included partner, how to organize it. And basically, in general, I have learned that the good contract, really good contract with both of them and with the couple is needed, very transparent one, that we have actually separate goals, because when I do individual therapy, I do individual. When I treat the person, when I do couples, I treat the relationship, and they need to understand that. So I explained this. So we have separate goals. I have still goals for the individual person, patient, and I am setting up the goal for the relationship, for the couple. This is the first thing. The second thing, I tend to set limits on them, that we really will have separate sessions, and I ask them to keep the boundaries. I keep the boundaries myself. So I say basically, this is our goals in the couple. We will have our separate sessions for couples work, and you, my patient, that was the primary patient, you will have your own goals and your own sessions separate from couples, and we are not going to talk about the partner in that sessions, not to mix them with the individual sessions during the couples therapy, right? So I make it very clear, and that when we will go further with the individual therapy, this is because we are going to do the goals that we have had already set before the partner had set before the partner joined. I also say that if during the couples work, they will somehow decide that they will break up, like finish the relationship. I originally used to be the therapist of the primary patient. So I will go back to being her, it's usually her, in my case, her individual therapist. And the joining partner, as far as for me, needs to know it, needs to understand it, and needs to agree to that, I'm joining you, I'm inviting you into individual therapy to make it couples therapy. We will work and do our best. But if something happens, then I stop the couples therapy and I'm still the individual therapist of the person that used to be my patient before we started the conjoint work. Well, I think that the therapist's healthy adult is needed here when you do something like that, because I think I'm responsible for explaining all of this, keeping really boundaries here, having available slots in my schedule, because when I'm providing couples, I might need separate slots for individual sessions connected with couples therapy, but also I need to have a slot for my individual patient, the person that used to be my individual patient before I started the couples therapy. So I cannot be overscheduled. I cannot be, because then I am overworking and I'm overburdening myself, right? So I need to keep boundaries. I need to have this schedule slots for schedule them properly. And I really need to inform them how it will look like. And the partner that it's included needs to really understand that he is joining, then we are doing the couples work. He needs to agree to that, and that he will be informed from time to time that we are continuing the individual therapy on the side, but there was nothing about him, so that he can be, of course, feel secure. So why to do that, actually? I realized that it's helping my patients, individual patients, to share, actually, it will sound strange, but share me somehow with the partner. I have one patient that told me, I'm not going to invite my husband because I don't want to share you with him. And they need couples therapy, but she doesn't want to share. This one that I'm talking about today, let's call her Betty, as Eckhart usually does, she wanted to share me, but she really told me, I really don't want to lose what we have already done. So I said, okay, can we then invite the partner, because we were working on the relationship, but it turned out that it wasn't enough. It was really, we started to feel that it would be a very good idea to invite him to sessions. So we decided, okay, we will invite him to the sessions. But as you say, I told her, it's maybe worth continuing your work on the side, but it will be separate work from, the couples work. But you need to know that we are not going to talk about him in that sessions, because if we are going to talk about him, then it's individual sessions during the couples work. And she said, yes, I have my own goals. I need to work further. I cannot stop the therapy. This is not for me. But if we can do it parallelly, that's fine with me. So not to interrupt the unfinished therapy, actually, maintain the gains that we have already had, and to further work on goals that we have set before he joins. We have been working on the relationship, but it turned out that it wasn't enough. So we decided to expand it to couples. And then you have this kind of situation that you have had an individual patient and individual therapy. You are going to keep it, but you are doing a separate slot and separate therapy for the couple. And you need to imagine that the situation that he is from different country. She wants him to come to her, like move. He's slow in action, and she gets frustrated, and they are considering when he joins, do they stay together or do they split up? So if we look at the mode cycle, we will see in Betty that active child mode would be angry, impatient child mode on the backstage. I'm angry, I'm impatient. Then on the front stage, she is showing the coping mode, which is a kind of over controller. She makes pressure, she insists. She is on the red leg, actually. She is more self-centered and she's more like pushing. Come on, guy, move to me. I want to be with you. Otherwise, I'm considering splitting up. So she's making the pressure. Then she triggers his active, his schemas, of course, but his active child mode is pressured, angry child mode as well. And what's coming up on the front stage in a coping mode, in a behavior, it's more like the touched avoidant protector. And actually, when they watched still face video with me, which Eckhart proposes to watch with the couple just at the beginning, it's like the first or second module when we watch the video with the couple, he just shouted, "It's me, I'm doing the still face." And she was like, "Yes, he's doing the still face." So when he is angry, he goes into the still face, which is like checking out from the cycle, from the couple, but more on the red leg, more on the red side, being angry underneath and kind of, still face. Or when he speaks up, it's a kind of malicious commentary. Sorry. Yeah. So when he joins, we have this kind of situation. And we, of course, together in the conjoint work, we try to go through the modules. They are not very much rigid, so I do not have to use with them so much externalizing modules for externalizers and for internalizers. This is not what I had to do. I needed to educate them. I did some conjoint imageries. I did homeworks with them, for sure. I taught them connection dialogue, which was very useful for them. And it was going somehow smoothly. And then, because she really wanted that, and this was the condition of inviting him into the couples, we were doing the individual work with her on the side, on the separate slot, in the separate sessions. And we did, during that sessions, her individual from that conjoint therapy goals, nothing that had to do directly with the couple's issues. This was our agreement that this will be about work issues, and she has ADHD traits, so many ideas at the same time, and we work on what to choose finally to earn money. We were working about enmeshment issues, enmeshment schema with mom and with brother, and we did a lot of imagery, rescripting, chair work, role plays, setting limits, training. And she has vulnerability to harm and illness schema. So we also did, and we are still doing actually, imagery rescripting to heal fear and insecurity. Sometimes it might be connected, of not sometimes, quite often, when she gets better in work, in ADHD traits or enmeshment or whatever, this will of course influence somehow the couple because it's obvious, but it's indirectly connected. So still, I think I can work with her, keeping boundaries. This is couples, this is individual. I can still work with her on that, having in mind that this will indirectly influence the couple, of course. And we have had the agreement that if anything here, because it might happen, comes up about the partner, we will immediately bring that to the conjoint session so that he feels safe. But she was generally very good in keeping actually boundaries. So this is me showing you, so before that, this is me showing you how I combine the couples work when the partner joins with the ongoing individual work. But during that therapy, and that's why this case study is, I think, interesting, something happened in his life, and sorry, that's not the slide. Something happened in his life actually that also made me to do the individual work with him. But I've decided that I would not go on the side with him, but I would stay in the couple sessions and actually do the work in the presence of the partner. So during the therapy, his mom visited, so everything was going smoothly, and they were just about to go back to a good track. And you know, he considered moving to her and being together, and she was more happy with that, and they were more blue and connected with each other, and everything was fine. But then, you know, during the therapy, his mom visited him from another country, actually, and it turned out that she has been sick since a while and needed a lot of administrative assistance and needed to stay with him for 3 months, over 3 months. They haven't seen each other for a couple of years because of family issues and pandemic, which was a difficult thing. So they had reunion after a really few years. And it turned out that she will, after these administrative things, she will again go back to her country, and they will separate. And because of that, she was sick. It was for me a kind of question mark moment. Is that the last time that he sees his mom? So is that the moment to say goodbye? So you can feel the heaviness of the situation. They haven't seen each other for a few years, and mom is sick. And then I have in my head, you know, a doubt, a hypothesis that if he's going to move over to my patient, then maybe it's a good saying goodbye moment to his mom. So it's a serious situation that influences the couple, and it stops us. He stops working on moving. He is again slow in the action, which makes my primary patient unhappy. So the conceptualization is, from my side, is, you know, I need to reconnect him with mom, prepare him maybe to say goodbye. I have only 3 months for that, because I think that if he does not emotional work here, he will not be able to be in the couple's issues. And then you have the dilemma, because you can do individual sessions on the side on mom topic, let's say, versus individual work in the presence of partner. I've decided that if the couple was not stuck in connection, in reconnecting with each other, and we have had coming into the situation harsh circumstances that influence the life of the couple actually, so so it was connected directly because it stopped him from moving, right, from moving over to her, like the coming over to her, to my patient. So I decided that it's directly influencing the couple issues, the couple goal, so going back to track, being together, him moving. I decided that maybe it's a good idea not to take him to individual sessions actually, but make the individual work in the presence of partner. And I saw only advantages actually about that. So when she is present in the, I'm working on the mom. I'm trying to reconnect him with mom. I'm trying to prepare him to say goodbye to mom, but she is present when I do it. She understands and feels more the situation with mom when she's present. I can engage her in supporting him in sessions and outside sessions when we talk about the situation, and they have only deeper connection. I can do with him, because he needed that, conjoint imagery rescripting around clashes and fights with mom. She can enter, I don't have to. She can enter and care for him. They will have only deeper connection. Of course, we are taking care of him. Of course, we are doing an individual work, but I try to join her, invite her to be as much as possible in the situation. So we did imagery around managing clashes with mom, overcoming the block that stopped him from hugging his mom and telling her he loved her, telling mom also goodbye. We rehearsed, you know, in future imageries, we rehearsed saying goodbye before she travels back. And my patient, was getting into the future imagery and also supporting him in rehearsing. And then the homework was, please spend some time with your mom and try to do what we have rehearsed, practiced during the session. And actually, the advantage additional advantage was that it turned out that turned out what I suspected before, that his reactions to mom resembled actually his reactions toward the partner. So when he fought with mom, he also used to go into still face. So it turned out that he learned still face with in the relationship with his mom. So the partner better and him as well, they understood better where does it come from, how to translate what we have discovered working on mom issues, let's call it like that, issues with mom. We discovered that it's coming from the relationship with mom, but also how to translate the results of imagery with mom to their relationship. I learned my still face with mom. It doesn't work with the partner. We need to remember that when we do it, we need her consent to do the individual work in her present, because, and I need to take care of her. Give me the sign if you are feeling left aside, because my patient has had, she has actually deprivation schema. And she understood that very well, that it's needed for us to do the work in her presence, because otherwise he's not able to be again in the couple's issues. So to sum up, having one couple in the therapy, this particular couple, I provided regular couple therapy with the partner that joined, and this is Eckhart's model itself, with some individual sessions on the side to clear things up, because I had actually, during the couple session, I had individual sessions, for example, with him to ask him if he really wants to move from one country to the other country. Then I provide, having one couple in the room in the therapy, I provided individual therapy on the side of her, not to interrupt the original therapy, right, of her. And this was her condition of inviting him to the therapy, that we will proceed with her individual therapy, but we need here separate goals and setting. I did also, having the same couple, I did also individual work in the presence of partner to reconnect, to connect them more and keep going with the couple's work when something really important happened to him. So just to, maybe say some take-home messages. Couple work is a conjoint work. This is definitely the truth. We treat the relationship and not the individual person. Eckhart Roediger's model promotes conjoint sessions and recommends individual work when couple is stuck. We do individual sessions when they are stuck and we want to unblock something. This works very well when a couple comes together. So you don't know anybody and they come together. But when the partner joins and you used to know that one patient, for a few years, and then you include another a party to the therapy, it's maybe worth continuing the individual therapy, not to cut down the unfinished work with the primary patient, like the original patient of yours. And when it happens, we work on the issues that are not directly connected with couples issues. And this needs a good contract and keeping really good boundaries. When the individual work needed, but the issue that comes up is directly connected with couples issues and the couple is not stuck, it's worth considering to do the individual work in the presence of partner. I see only the advantages. In both cases, it's worth remembering continuation of individual therapy and individual work in the partner's presence. Very important are boundaries, setting limits. So a good contract is important. And I need to have healthy adult to separate things and keep boundaries. Thank you very much for your attention. I hope it was somehow inspiring for you and that you enjoyed spending a little bit of time with me. Enjoy other presentations. See you later. Bye-bye.